I'm going to the dentist today, and it makes me think of the experience of going to the dentist while I was in prison. And it was a pretty varied thing because medical care was really varied. We had really good doctors at times, and we had really terrible ones. I mean, we watched guys get diagnosed with cancer 6 months after they started complaining, where they'd been sent back to the unit with Motrin over and over and over. As far as dentist, it started out really strong. We had the same dentist at the first prison I was at for 4 years as the next prison I went at for 13 years, although he left partway through that cycle. And I can't remember his name, just absolutely awesome guy. Treated everybody like a human being, was interested, would go above and beyond, like I had a chipped tooth. Remember, he was like, look, I'm not allowed to put a veneer on it by policy, but like, hey, let's see if I can find some time. And sure enough, he found time and he put the veneer on there. And I still remember the dental assistant because she was just really cute and really sweet. I remember talking to her one time being like, hey, how did you learn to just treat people like people? She goes, you know what's funny? People ask me that all the time. But when I started, I was not a nice person. Like, I did not treat people well. I just thought like I had to keep my guard up and I had to be protected against the prisoners and the, whatever. And she said one day I said something and one of the nurses was like, yeah, that's right. You get him. You get him. And she said she just stopped and she was like, wait, I don't like this. Like, I don't like somebody else celebrating me basically being a jerk. She said, and that was a wake-up call for me. And I was grateful that I got to meet her after that. But I also love that story of like redemption, of realizing she was doing something that isn't what she wanted to do or wasn't consistent with her values and deciding, hey, I want to do something differently. Like, I think this is important. I just thought that was really awesome. But he was great. Like I said, he fixed my veneer. He would get people in there. I remember I was in one time and he started asking me like riddles and questions. And we went back and forth and he like went and looked things up from the book. And he was like, man, you're my last patient of the day. Like, I'm supposed to go home, but like, honestly, like I have just as much fun here. He stayed for like 30 minutes just kind of shooting the shit with me. And that was really awesome. And it was those little things that really made it feel humanizing. He left, we got a different dentist, and it wasn't a particularly good situation. I don't want to say he was bad. I don't know where the breakdown was, but it was hard to get in there. When you did get in there, he didn't really seem to care. He definitely wouldn't go above and beyond. A lot of times he wouldn't even like address the actual need. Somebody'd go in with a cavity and be like, all right, well, I'll schedule you for this. Okay, well, like, can we like find out some more details? Be like, yeah, I'll get it done. Then it got to the point where they stopped having a dentist altogether. So Fluvanna Correctional Center for Women had this massive lawsuit because 4 women died basically from neglect, like from clear medical, like denial of service. They won this lawsuit and over, Fluvanna basically failed to live up to the basic standards of like providing medical care. So finally there was oversight put in and all this funding was shifted to Fluvanna. So they had like 2 doctors instead of 1. They had a dentist and 2 full-time dental assistants. They had just like more staff than anywhere in the state. And it wasn't like the state came up with more money. They just pulled resources from everywhere else. So when I was at Buckingham, after the second dentist, who was kind of a problem dentist, we just didn't have a dentist for 5 years. Like literally there wasn't a dentist. They would call somebody in maybe, once a month for emergency procedures if there was something going on, but that was it. So if you just needed to like get your teeth cleaned, remember I was waiting for 4.5 years to get my teeth cleaned. And the only way I managed to do it was because Jens Soring, who is the subject of Courtney's podcast, who was kind of an international celebrity, had gotten his teeth cleaned. And so I wrote an informal complaint, said, I've been waiting for 4.5 years. I have not gotten my teeth cleaned, yet this man, because he's a celebrity, gets his teeth cleaned within 2 years. They responded like, hey, this isn't a problem. I filed the grievance, which would then go to Richmond. Like it would go above the institution actually to Richmond. And I don't know why, but they were like, all right, we're really sorry, Mr. Crossan, like we're gonna get you in here. And they got my teeth cleaned. And I felt bad because the dental assistant was a really sweet woman. And I talked to her about it and she says, look, I'm so frustrated because they don't even have the job listed. Like, it's not like we just can't get somebody to apply. Like, they're just pretending it's listed. There is no job listing, and they have no intention of putting a job listing because there's no money left. Like, all the money has gone to provide treatment, and apparently still really poor quality treatment at Fluvanna, so there's none left for the guys. There's none left for the rest of the state. And it just blew my mind that they would literally decide we're just not going to provide, like, dental care, or maybe we're not going to provide, like, mental health care, or maybe we're not going to provide medical care. That was their response to a lawsuit where they failed to provide medical care. It's just absolutely insane to me. But unfortunately, that's all too common a reality. And not that long ago, I got a notice from one of the staff at Fluvanna that the warden at that time had been walked off for embezzlement. And I haven't been able to verify everything, except that I know that the warden who was there, Lefevers, who was also at Buckingham, who in my experience was not a very nice or even decent person, is not in fact there, and they have an acting warden. Now the state has refused to say why. They've just said, we have no comment on the matter, we have an acting warden. Some people have said, oh, well, we think she just, is ill. Other people have said whatever. But the staff that contacted me said, no, clearly she was stealing and she got caught stealing and that was the issue. And that continues to be the problem because there's no oversight over DOC or the medical care. Like, we have no oversight over DOC. Imagine if, like, you have a business and you can just kind of do whatever you want with the money. And if it's your money, that's fine. But if it's everybody else's money, that's a problem. Well, the DOC has all the taxpayers' money. It is one of the largest departments in Virginia, or in pretty much any acting state. And yet there's no oversight. There's no council, there's no committee, there's no group that says, hey, why did you spend this money here? Or, hey, why aren't these guys getting medical care? Now, delegates and senators can directly ask those questions, but they rarely do. Strangely, one of the guys who I had an issue with because he was principally like the opponent of criminal justice reform, he was one of the only people who stepped in when we had no heat all winter. Like, it's winter, it's like 12 degrees, there's ice on the inside of the cells, and they're like, oh yeah, it's fine, like, we'll get to it. But he called and raised hell, and they actually went and they fixed the heat, which, again, blew my mind that he would be the one who, again, was opposed to any kind of reform, but was the only one to actually respond to letters and respond to calls and respond to, emails from people on the street. So it was positive to see that. But again, as I go to the dentist today and recognize that I'm going to get really good quality dental care, and yeah, I probably got to pay out of pocket. I have dental insurance, but I have no idea what it covers. Every time I pay my insurance bill, I kind of feel like I'm just giving them money because it's not going to cover anything anyways. But at least I know that I'm going to get quality dental care. They fixed my tooth when I first got out, which is a reason I'm always going to go to this dentist. Because he reached out and was like, hey, I love your story. I want to support you. And this would have cost an insane amount of money. And he was like, all right, let me just shake your hand, like, make the best of your second chance. And that was the attitude that I've tried to carry forth. Like, how can I help somebody else out from where I am with what I have to make sure that they have the opportunity to make the best of their second chance? So now if I got to pay for a teeth cleaning and a checkup, I'm definitely going to do it. And I'm definitely going to go to him because I see that he's the kind of person who will do that for others. So let me go get to the dentist, get my teeth cleaned, and thank you for watching.